Yes, it is already 6:05. A very good evening to everyone. I am Manjari Bakle, Assistant Professor in Psychology from DCT's Dhempe College of Arts and Science. I welcome the principal of our college, the HOD of our department, the faculty, students, and participants to the national webinar on minding our minds during COVID-19, organized by Department of Psychology, DCT's Dhempe College of Arts and Science, Miramar, Goa. Before we start with today's session, I request all the participants to keep their mics on mute when the guest speaker is speaking. If any question related to the topic of the session, I request everyone to post their questions and queries in the chat box when the floor is opened for questions at the end of the session. The link for feedback forms will be shared in the chat box at the end of the session. Once again, on behalf of DCT's Dhempe College of Arts and Science, Miramar, Goa, and Department of Psychology, I warmly welcome everyone. We all know that COVID-19 pandemic has led to a dramatic loss of human life and has posed various challenges before every section and every age group of the population. Till today, 4,01,050 Indians have lost their lives due to COVID-19. School closures and home confinement have caused distress among children. Due to home confinement and little or no access to peers and teachers, disruption of daily routine, and lack of physical activity, adolescents have been experiencing chronic and acute stress. Thousands of people in their early and middle adulthood lost their jobs. Hundreds of enterprises continue to face an existential threat. With the virus largely affecting the elderly, the impact of COVID-19 on older adults has been notable too. Those on the deathbed due to COVID-19 have been bidding adieu to the world in isolation, deprived of the emotional support that the family members offer at the time of death. And the family members of such critically ill patients, on the other hand, have been from a distance being robbed of the opportunity to gain a sense of closure. Regardless of the various projections and predictions being made by experts, the pandemic has proven that the only predictable thing about COVID-19 has been its unpredictable nature. Hence, it becomes important that we explore the various strategies to live life despite these unprecedented challenges brought in by the coronavirus. Before we start with today's session, I request the principal of DCT's Dhempe College of Arts and Science, Professor Vrinda Borkar, to kindly say a few words. Ma'am, over to you.
Thanks, Manjari. And I take pleasure in welcoming you all for this online webinar. And I welcome the students, the staff who have joined from all over India for this webinar. At Dhempe College, we always look for the need at a particular moment, and actually the psychological need of human beings. Manjari has nicely explained the various in detail problems faced by the society. And it is a apt topic at this stage to think, to be positive, to think in a positive way, and also to think that this bad phase will also go. After 6 months, maybe after a year, or maybe after 2 years, or maybe that we will be adapted to this type of style also. We do not know, but definitely there will be a change. And we have to only adapt to the change. That on this earth, who survived? The very strong species? No. Then dinosaurs would have been alive till the date. Very cunning species? No. Very intelligent species like human being? We can say yes only if we adapt to the change in the conditions. So unless you adapt to the surrounding, you will be just away from this earth. And so we have to keep an attitude, positive attitude, in spite of many problems that we are facing. And I appreciate Department of Psychology for organizing this webinar at the correct time. Actually, after the second wave, there is a real psychological problem in the society. We left. It may be because of your financial loss. It may be something more than what we say. But definitely, people are going through a trauma. Psychological needs have been felt. And at this stage, I appreciate Dr. Cindy, who will be dealing with today's topic. So, once again, I welcome all on this online platform. Dr. Mukta, Manjari, as well as Dr. Cindy for organizing this webinar in the interest of public. I hope this YouTube will be shared on public platform so that it is of use to many more people beyond those who have joined online at this stage. So thank you all for joining, and all the best, Dr. Cindy.
Thank you, ma'am. Before I invite our resource person for today to start the session, I would like to introduce her to the audience. Our resource person for today is Dr. Cindy DSilva. She has completed her Bachelor degree of Arts in Psychology from Goa University. She completed MA in Clinical Psychology from Goa University. She has been awarded PhD in Positive Psychology from Karnataka University. And she has also completed Master's degree of Arts in Education from Indira Gandhi National Open University. Dr. Cindy DSilva has worked as a counselor specialized in marriage and grief counseling. She has also worked in Carmel College as a coordinator and assistant professor for the postgraduate department in counseling psychology. She has worked in Nirmala Institute of Education as a coordinator and assistant professor for the MA Wellness in Counseling. And presently, she is working in Dhempe College of Arts and Science as assistant professor for the Department of Psychology. She is also a visiting faculty in Institute of Nursing, Bambolim, Goa, from the year 2019 till date. As far as the research publications go, she has published various research articles on the topics such as suicide attempt, a cry for help, social media addiction, psychological impact of abuse and neglect, and various other topics under positive psychology. in various national and international journals. I request Dr. Cindy DSilva to kindly start the session that everyone has been eagerly waiting for. Dr. Cindy, over to you.
Thank you. Okay, first of all, thank you, Manjari. And first of all, a very good evening to all you participants. I would like to take this opportunity to thank our principal, Professor Vrinda Burkar, our head of the department, Dr. Mukta Karmari, for giving me this opportunity today to conduct this webinar. So I'll quickly share the slides with you and we'll start with the webinar. Yeah. So the topic that we have taken up is minding our minds during COVID-19. He has already spoken about what COVID has brought in for us. Okay, I would not touch up much on that because we too are aware of what is going on and how COVID has affected our daily routines, has caused disruption, and many people have lost their lives. Many people have lost their jobs. So we'll directly get to our agenda and we'll see what we are going to cover today. So today we are going to talk a bit about mental health, effect of COVID-19 on mental health, the stresses, strategies to take care of ourselves, grief and loss, daily practices, and new perspectives. Once we are done with the presentation, I would like to address to the questions that we have received through the Google Forms. And then maybe later on, I'll by the participants. So we all know in January 2020, the World Health Organization declared the outbreak of a new coronavirus disease, that is COVID-19, to be a public health emergency of international concern. WHO stated that there is a high risk of COVID-19 spreading to other countries around the world. And in March 2020, WHO made the assessment that COVID-19 can be characterized as a pandemic. So if we look at this data, we can clearly see that it's been more than a year that we are suffering and we are going through this phase, which is a very difficult phase for all of us, causing a lot of loss to lives, loss to people have lost their jobs, and has caused a lot of disruption. So the question that we need to ask ourselves now is, can we wipe out the disease or can we undo the damage caused by COVID-19? Now, if we talk about can we wipe out the disease, maybe we could say yes, to some extent we can take precautions. We can try and be at home and only move out when necessary, right? But overall, can we really wipe out the disease? And the answer is no, we can't do it on our own. All that we can do is maybe inform people, educate people as to how to go about and take up precautions to deal with this difficult times. And the next that we have is, can we undo the damage caused by COVID-19? People have lost lives, people have lost their jobs, people are suffering. And when we look at it, the damage done by COVID-19 is something which cannot be undone. Yes. So the answer to these questions is no. Yet we humans have survived plagues. We have survived many difficult times. And today what we are going to discuss is, despite of us, how can we try and survive this phase? How can we live or how can we fight this COVID-19 in our own little ways? Let's quickly get to the definition of mental health. So mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. And this definition has been given by the World Health Organization.
Dr. Cindy?
Yes?
I'm sorry to interrupt, but if you're changing the slides, the slide change is not visible to us. We are still able to see the third slide.
Second. Okay, so should I keep it in this format only so that?
Yes, I think better.
I think this would be better, right?
Yeah.
It's readable?
Yes, it is.
Okay, thank you. So we were discussing about the mental. So mental health is a state of well-being in which an individual realizes of the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Now, this is a definition that has been given by the World Health Organization. So, if you look at the concept of mental health, it includes our emotional, psychological, and the social well being. It affects how we think, we feel, and we act. And it also determines how we handle stress, relate to others, and make choices. So, what is the effect? How has COVID-19 had an effect on the mental health? So, some of these effects that we have listed includes fatigue, anxiety, fear, loneliness, lack of motivation, feeling of sadness, feeling of helplessness, poor work-life balance, increased substance misuse, and grief. And what are the some of stresses? And these stresses include rumors and misinformation via social media. So today we all common concept is known as the WhatsApp University, through which we get a lot of data which we don't really know whether they are facts or rumors. Messages, information is just been spread across. So this itself can be very distressing. This can add on to a lot of stress, because the moment you receive the message, the moment you get the information, even before you check for the facts, yes, it will cause a lot of stress in people, because we are already going through a very stressful phase. Another stressor would be lockdown and curfew. This is one of the major issue right now, because whenever a lockdowns are declared, whenever there's a few people, possibly people who are financially sorted might try and get their, they might just go and buy whatever they need, their requirements. But people who are financially not sorted might have a difficult time, because they can't just go and buy in bulk. So lockdowns and curfew have also been stressors. Travel restrictions. So we have a lot of travel restrictions due to COVID, and that has also been a stressor. People have lost their jobs. People are facing financial crisis. Possibility of physical isolation and quarantine. So people, if diagnosed, or people who were diagnosed as COVID positive, or they had their dear ones who were diagnosed for COVID, then the possibility of physical isolation can also be a stressor. So the thought itself that if somebody in my family is affected by COVID-19, then that means we have to be isolated, and how we will survive isolation. That thought itself can be very stressful to people. Also, risk of relapse in pre-existing health conditions. So today, with fear of COVID, people are not moving out of their homes, and individuals who are already having health conditions, that could be very difficult for them because of the fear of COVID. They might not seek help. For example, a person who's been diagnosed for cancer, who goes for a routine checkup, might not end up only because of the fear of COVID. Recently, there was an interview put across by one of the doctors from the Manipal hospital just 2 days back. And he talks about how earlier there were cases that would come in at the initial stage, cancer cases. But right now, he says when people come in at the third or the fourth stage. So he says that because of this fear of COVID, people are so scared that they don't want to even seek help. Yeah. And last one, but the most common one, is the symptoms of other health problems that can lead to fear of infection. There was a time where we never bothered about who's sneezing or who's coughing. But today, when you see someone sneezing or you hear someone coughing, everybody's alert. That person becomes the center of attention. Everybody's scared that, okay, what is this now? What's coming up? So yes, these are some of the stresses that I have listed down. And with this, we'll move on to the next one. That is, yes. Before we get into the webinar, or before we get to the topic, first of all, what we can really control is stay away from rumors. Stay away from rumors and know the facts. So whatever information comes in, the first thing that we need to do is understand whether they are rumors or whether they are facts. Because the moment the information comes in, and because we are already undergoing stress, we are going through a very difficult times, these rumors can add on to our problems. So first of all, we need to know the facts, which means every time we get information, it is important that we get this information verified through reliable sources. So for this, avoid media overload. avoid watching too much of news related to COVID-19. So if you look at the social media right now, if you just go on YouTube or you check the sensational news that we normally see, we want to see the news and check out how many cases are, how many new cases have come up or how many deaths. So this adds on to a lot of stress. Yeah, and if you look at the YouTube today, they are loaded with videos that only show deaths, and these videos can be very harmful to all of us. So we got to avoid too much of news that is related to COVID-19. Also reduce use of social media. So we all know that today, if you look at the social media, it's a platform where everything is posted, and COVID being the main issue right now, everything, if you check any of the social media platforms, you will only find news related to COVID-19. Yeah. Next, refer to reliable sources to obtain facts. That is, as I said, the moment we receive information, it is important that we check these facts with the reliable sources. Even with the vaccine, there are there's so much of information that's coming up. Some say that the vaccine would be of no use. Some say that a vaccine is just waste, or some say that vaccine can have harmful effects. There's n number of information that is available today, but we as individuals need to check out whether it is we need to check out with the reliable sources whether it's fact or just a rumor. And the last one, of course, I've marked it in red. So if at all, definitely things are going on, so we can't avoid, right? But at the same time, we also need to check on what are we focusing on. And at this stage, besides watching the sensational news, besides watching the videos, besides being updated about how many new cases have been reported, we need to also focus on the recovery rate, because recovery rate itself will give us a hope. It's a sign of hope that tells us that yes, we are going through difficult times, but there are people who are recovering. So we need to avoid media overload, at the same time focus on the recovery rate. All right, what do we see here? If you could quickly put it in the chat box. Maybe not the whole description of the picture, but if you could quickly post in the chat box as to what do you see. What is the first thing that you see in this picture? Yeah? Could you quickly post in the chat box? Okay. People see things differently. And therefore, if we think in a different way or in a negative way, there is a space for us to change it and look things from a positive perspective. So with this, we'll now get on to how we can mind our minds. So first of all, we need to be sensitive towards oneself and others. So if we are not sensitive about what's happening to us, we won't be able to sense what is happening to others. So it is important that we are sensitive towards ourselves as well as others. So maybe you can check on lack of interest. So why are you losing interest? Do you feel that you get bored very often? You have no interest in anything? That's one. Difficulty in concentration. Do you feel that you are not able to concentrate even when you know that you have to complete the work? You're just not able to concentrate. Change in moods, changes in eating habits, changes in sleep patterns, and even increased use of alcohol, tobacco, or drugs. So we need to be sensitive towards whether this is happening with us or whether it is happening with people around us. Also, we need to recognize some of these. We need to recognize these signs. Okay, and when we say recognize, we need to recognize in terms of we got to recognize with ourselves whether we are going through it or our dear ones or people around us. Some of the things that we can try and recognize include stress, irritation and frustration, sadness and depression, and hopelessness. Now, for any problem to be taken care of, first of all, we need to be aware of it. If we are not aware of it, then we will not be able to take care of it. And that is the reason why we need to be sensitive towards us. We need to be sensitive towards people, and we need to recognize. So once we are sensitive, we will be able to recognize. And if we recognize, then being aware, we will be able to treat the problems. So this brings us to our topic, that is minding our minds. And in here, we are going to talk about behavioral strategies. We're going to talk about cognitive strategies. And in the end, we'll briefly discuss about grief and loss. So, what are behavioral strategies? Now, in here, we are going to talk about some of the strategies that we can use to take care of ourselves. One of them is breathing exercises or meditation, then grounding techniques and behavioral examination. So, when we talk about the breathing exercises or meditation, so here maybe we could talk about how we can be aware of how can we practice mindfulness. So instead of being all over the place, we need to be a little bit aware of here and now. Okay, so constantly listening to the number of deaths reported, it can be very depressing, it can be very distressing. So as you're doing this, it will affect you, it will affect your mood, it will make you using. So just be aware that you're doing it. That's one way. Next is maybe take a short things that are there. So that's called mindful walking. So as you go, maybe you can see things around you. Maybe if you're just having a walk outside your house, you can pay attention to the garden that you have or the trees that are there. So you can do that. Or maybe hold a piece. So when you hold a piece of ice, just concentrate on how long does it take to start, how does the sensation change when the ice begins to melt. So there are so many things in our lives that we take for granted, we just don't pay attention to. So now maybe instead of focusing on all that is going around, all that is going on around us, we can just focus on here and now moment. And lastly, we have the behavioral examination. So for behavioral examination, what we can do is maybe do a bit of journaling. So we can write about activities that make us feel good and activities that make us feel bad. So things like in today's day, if I did some gardening and that made me feel good, write it down. Maybe trying a new recipe or trying a new dish, write it down. Okay, thinking about problems like I can't join my work, I'm feeling so depressed, there are so many cases. And as you write it down, just be aware of what are you feeling. What are you feeling when you're writing the activities that made you feel good, and what are you feeling about activities that made you that made you feel bad. And so you are aware of what how these activities are affecting you. Another way could be is maintain a weekly schedule. So what we can do here is have a table like it has been presented on the slide, and just put up your days. Okay, Monday, Tuesday, Wednesday, all these days, and then divide it into three sections. Okay, so we have morning section, afternoon section, and evening section. So we have morning section. Morning, what did I do? So I woke up, I had my breakfast, maybe I spoke to my parents, or I watched news. Okay, or I just watched some WhatsApp video which was sent to me by my friend. So just report these in these sections. And once you are done with all the three sections, that is morning, afternoon, and evening, write a note to yourself. Now, what can we write here? Write how you feel about all this. So as you write down, definitely it will have an impact on you, right? It either you'll be happy, or you'll smile when you say that I laughed a lot today when I saw the video, or I was feeling so sad when I saw when I heard that some young person passed away. So write a note to yourself about how are you feeling about all these activities that you conducted throughout the day, or the activities that you were involved in throughout the day. All right. Now, here we can also make a list of activities that you enjoyed the most. So once you are done with writing the note, then again, you can also make a list of activities that you liked the most. So if suppose in a day, if you have done gardening, you tried a new recipe, or and say maybe you had some you learned some new dance steps. So in these three, which is the activity that you like the most, and just be aware of the feeling. How are you feeling about it? So maybe if I like the fact that I learned some new dance steps, then how am I feeling about it right now? So that is something that we can jot down, or we can write it in our journals. And also list of responsibilities. We all know that sometimes you have some important things to be done, and yet this boredom, this feeling of depression, or feeling of loneliness doesn't allow you to complete your work. You know that you just have 2 days, you have a deadline, but still you will try and stay away, or you just don't want to do the work, because you yourself, you don't allow yourself to do the work because you're so disturbed about what is happening around you. So in this case, when you take the initiative and make yourself take up the responsibility and do what is to be done, then also make a list of those responsibilities that you have taken up, okay, and completed. And then you write down how do you feel. Write down how do you feel, how did you feel before doing the work, that is before getting into the activity, and then you can mention about how you're feeling right now knowing that you completed the work. So that's another way of taking care of our behavior. So basically, you're assessing and keeping a check on what's going on. And maybe on a Sunday, once you complete, so once since it's a weekly schedule, once you're done with your weekly schedule, maybe on a Sunday or maybe on a Saturday, because these are the weekends that we have, maybe you could sit for some time and just write the entire summary about how you feel about this entire week. That is from Monday till Sunday, how are you feeling? Or from Sunday to Saturday, how are you feeling? The fact you got to mention about what things you had done. So you already have the table here. So when you look at the table, you got to mention how do you feel about it today, right now? How are you feeling about the entire week that you have spent? Okay. With this, we'll move on to the next one, that is cognitive strategies. Now, in cognitive strategies, this basically involves monitoring our fears, worries, anxiety, frustration, etc. Again, what can be done is journaling. So basically, keep a record of your fears, your worries, your anxieties, your frustration. Okay, and sorry, and when we are keeping a record of all these feelings, all the fears, worries, anxiety, frustration, when you write it down in your journal, you have a space to write an explanation as to why you're feeling it. Right now, if the moment you hear the number of cases rising in the country, you feel the pressure, you feel stressed out, right? But if you just sit in a place and ask yourself, what is it that makes me so anxious? What is it that just worries me? What is it that causes so much frustration in me? When you start writing these things, it will help you to monitor. You will realize that half of the time it is something that it's our mind is a magnifying glass, right? We are like these magnifying glasses where the place where wherever you pay attention to, that area gets magnified. So right now, if I'm only watching news related to COVID, if I'm only keeping a track of the new cases that are being reported, what will happen? I'll be thinking about the rise. Okay, I'll be only thinking about the number of deaths that have been reported, rather than focusing on the recovery rate, and rather than focusing on the fact that I'm still alive. There are two waves that have already been gone, and I'm still alive and I'm not infected by COVID. So I'm forgetting how safe I am, and I'm only focusing on what is happening around me. So it is important that we journal this, or we maintain a journal and write back of whether what we are thinking, what we are feeling, is it real, or is it something that we are just paying too much attention to? All right. Next is be specific and concrete in your thinking. So for this, first of all, we need to check on whether the situation can be changed. Okay, so if the situation can be changed, then definitely we need to work on it. And if the situation cannot be changed, then we got to accept that the situation cannot be changed. Now, the problem is when we do not ask this question, when we do not ask ourselves whether the situation can be changed or no, we are constantly in this race of solving the problem. Now, we already know that we cannot just wipe out COVID from the face of earth, but we still want to fight it out. Okay, now this doesn't mean that we don't fight it out. What I'm trying to put across here is just by feeling sad, just by feeling depressed, will COVID disappear? That's the question, right? So here we got to focus on, can I change the situation? And if no, then we got to accept that yes, we cannot constantly try and work against this no, then we are heading nowhere. It will only cause more distress. By just keeping a track of people are dying, by the number of people are dying, by just keeping a track of how people are losing their business, and what negativity is, whatever negativity is taking place, what we are doing is we are only sinking into the negative side. Okay, so it is important to understand whether this situation can be changed. And yes, if the answer is yes to your question, okay, if you think that yes, we can change the situation, then how do we do it is, first of all, check out for what is the possible solution. So now, okay, on an individual level, we know that yes, we can save ourselves. We can take help all necessary precautions. So here the first thing is, what is the possible solution? Yeah, so maybe staying at home, right? Maybe it's easy for us to just put it on the slide and make it look like, okay, it's everything is easy, everything is fair, but it is not. There are so many people who have to move out because they are working. There are so many things that we need to do which we cannot do sitting at home. Yeah, so if the answer is yes, definitely look out for the possible solution. Then if you know that what will be the end result or what is the solution, then you got to check out what is needed. What are the requirements to achieve this goal or solve the problem? As we keep a check on what are the requirements, we also need to focus on the possible obstacles. So if I'm working towards a goal, if I'm working towards a solution, what are the possible limitations or what are the possible obstacles that can come and can happen, can sort of slow down my progress or can stop me from achieving the goal or stop me from solving the problem. And then once you're aware of what could be the limitations, the next thing is you got to plan for how to overcome these limitations. So yes, if we want to change, if the answer is yes to the fact that we can change the situation, then we got to plan these things out. That is possible solution, what is needed, possible obstacles, and how to overcome the obstacles or the limitations. So this takes us to the next one, that is reframing of problematic thoughts. Now here, first of all, as I said, we just sometimes tend to pay too much of attention to things, and that sort of magnifies the problem itself. So first of all, you got to bring your thought into awareness. Just be aware of the fact that you're thinking. Okay, so yes, I'm feeling sad for the people who are dying. I'm feeling sad for the people who are losing lives or people who have lost their loved ones, who have lost their families. Allow that thought. Okay, allow yourself to be aware of that thought. Next, question your thought. What am I thinking? Is this something that I can stop? Is this something that I can control? If I cannot control, accept it. If I can control, we already spoke about the steps that we need to take up. Yeah. Check the thought for distortions. So check out whether the thought that you have is really is it real, or is it that you are just adding on more stresses there. Just check out for that. Then check with the reality. So in reality, so if I keep on saying COVID has messed up with my life and I'm so fed up and I'm so done, at the same time in reality I'm working, I have my I'm financially fine. All right. And maybe, yes, COVID has had an impact on me in terms of I had to wear a mask and go. I cannot move out. There are restrictions when it comes to moving out. Okay. We are sort of confined to our homes. But if I'm saying that COVID has completely messed up with my life, but is it real? In reality, is it so? Have you lost your job? Are you going through difficult times the way other people are going? Have you lost your loved one the way others have lost? So you got to sort of compare and check out with reality as to what do you mean when you say that COVID has messed up everything or COVID is a destructive disease. Yeah. So you got to check this out before you sort of give too much of attention to it. And once you check with reality, once you check your thought with reality, then we need to rewrite the thought. And when we are rewriting the thought, maybe we got to replace with the positive self statements. So things like instead of saying that I'm so fed up with life, I'm so fed up staying in the house. Now, in reality, I know that I'm spending good time with my family members. I'm getting a good time to rest, which otherwise I wouldn't get. So maybe now I got to rewrite and say, okay, COVID has made restricted my movement, or COVID has made me stay at home. But in reality, it is not that bad. I mean, I can have a good time with my family members and really rest for a longer period of time. Because otherwise, we all know when we are working, we always look for the weekend. The moment Monday comes in, we always look for the Saturday, right? Because we need our Sundays. So if this is how we have been throughout, then can we now look at this as an opportunity that we are getting to rest, an opportunity to sort of spend time with our loved ones? So this is the reframing of problematic thoughts. So moving on to another topic here, a serious topic, that's grief and loss. So we all know that this has COVID has brought in this on a very large scale. You call every person and there is something happening around, right? So we all have lost our loved ones. Maybe we have lost family members. We have lost. There are people who have lost like the entire family. There are people who have lost many friends. So yes, COVID has brought in a lot of sadness in our lives when it comes to grief and loss. So grief and loss is challenging and distressing, but it can be transformational, and most of us over time develop skills and attitudes that assimilate our losses in our lives in a functional manner. So when we talk about grief and loss, the moment we lose someone, okay, at that moment it seems to be the end because we cannot think beyond. Now, why this is happening is normally when the person is around you, okay. For example, for a child, the parents are around the child, and when the child sees them every day, we don't think that, okay, they are doing something for us. We know that they are there for us, and we don't think beyond that. We don't think our lives beyond, we don't think ourselves in the absence of our parents. So what happens here is, on a day when you actually lose someone, it's a shock because you don't know how to look at your life right now, without this person, in absence of this person. So normally we cry a lot. Why do we cry? Why are we feeling sad when we lose? Sad because the person lived for a short time. Are we sad for the person, or are we sad for ourselves? Are we sad because we will be alone now, we will be lost in the absence of the person? So when we talk about grief and loss, it is that sudden change, a sudden change. We are not able to adjust to it. We're not able to sort of deal with it. We don't know what to think or how to go about with it, because now we don't know how to think about our lives in the absence of this person. So yes, if you look at every home, there is family has lost someone over a period of time, right? Whether it's due to COVID or any other reason, there have been deaths in the families, and people have lived life. Maybe at that moment, people have gone through the most difficult times, but over the time, people have lived life in a much functional manner. So so these are the five stages that I would like to talk about, which Kubler-Ross has put across, and that includes denial, anger, bargaining, depression, and acceptance. So as we said, initially it's very difficult for us to even imagine our lives without these people, but later on we learn to live, we learn to move on in life. Yeah. So it doesn't mean that you forget the person who's dead and gone. We don't forget people who passed away, but we move on with the memories, or we have our own coping styles, and we still know that yes, there is life beyond the person. Yes. Now, in the denial stage, what happens is, normally at the first stage, the moment you know that things have gone wrong, or the moment you know that you have lost someone, we avoid, we are confused, we are shocked, we are scared. So this is what we have already spoken about. We are scared. We don't know what to think about ourselves beyond this, in the absence of these people. We don't know how to deal with it. We are confused, right? So we tend to deny, because we don't want to even believe that, okay, this person is gone and now I have to live on my own. So that's denial. Then we are angry. Why are we angry? We say, why me? Why only my parent had to go? Or why only my friend had to go? Why only my family member had to go? We are frustrated, we are irritated, we are anxious. Now, why this is happening is because you know that you are not prepared for life without this person. Yeah. And when this happens, it becomes difficult for us to accept, and therefore the next thing that we experience is anger. Yeah. The third one is bargaining. That is, we are overwhelmed, we are helpless, there's helplessness, we are hostile. And what happens at this stage is, the moment you deny, the next thing is you experience anger. You experience, even after feeling angry, you still feel that, I wish this person was there, I wish this person was with me. You start feeling this, and what you do is you start bargaining. You just start thinking about life. What if the person was there? How would you go about? And that's what you do. You just want the life, you want things to be normal back again. So here, first you deny, you get angry, then you want again, you just have this unrealistic hope in you that, I wish things were not like this. I want things to be fine. You just want to believe that everything is okay, right? And then you know that despite of trying to believe that okay, things are still okay, or we have these unrealistic hopes. We know these are unrealistic hopes. We know that people will never come back. Then we are struggling to find a meaning. We are struggling to reach out to others, or we sometimes we can't even talk to others. Okay, now if you have noticed, in all these religious, if you talk about the different religions that we have, normally once people lose their loved ones, we have this different rituals that have been followed, and it is beautifully designed by our ancestors. So we have something like after the final rites, people come to visit the family members. There is something called as month's mind, or 12 days remembrance, or 21 days remembrance. So when these things are there, what happens is initially people who are grieving, they are going through denial phase, they are angry, they are bargaining, but these rituals help them to understand the reality or accept the reality. So every time people come in and talk about the person who's no more, okay, that helps them to accept that the person is no more. Whenever people start discussing about them, the people who are grieving also start talking about their loved ones. They start telling them stories about how life was with them, or they now open up. They slowly open up and they reach out to others. And the last one is acceptance, that is exploring options, new plans, and moving on. That is, once you have gone to this phase wherein now you know that this person is never going to come back, and you are able to talk about it, that's where the acceptance takes place. Now, although Kubler-Ross has put across these 5 stages, it is not necessary that people go through all the stages in this particular manner. Sometimes there is acceptance which is actually not acceptance, but people tend to take it like, okay, I'm okay with it, but after some time, again, they might just switch to bargaining, they might just switch to anger. So this depends on person to person. But in reality, acceptance is always last. Although people at the initial stage might say, I'm strong, I've accepted the death of my loved one, but we do go through all these stages before we reach out to acceptance. So how do we respond to loss? There is sadness, confront and avoid painful emotions. Sometimes we confront, sometimes we avoid. Attempt to reorganize our world, struggle with connections and disconnections, make sense of loss, make meaning. Sometimes you are just paralyzed, you're just numb about what has happened. Sometimes we try to find meaning in what has happened and then allow ourselves to transform, and also sometimes struggle to integrate losses into our lives. So these are the responses that come from people. Now, another interesting thing that I would like to talk about is whenever there is a death in the family, or whenever there is a death, people normally have this reaction which is actually not helping the people who are grieving. And that is, people will tell you, please stop crying. The person is gone. You got to be a support system to your family. You got to take care of your mom. You got to take care of your family. You are the eldest son, you're the eldest daughter. They start reminding you of your responsibilities and how you have to now take the new role. Now, the problem here is the moment you tell the person, look, the person is gone and you got to take up the responsibility, what happens is we are not allowing the person to grieve. We are not allowing the person to vent out what the person is feeling about the loss. Rather, we are telling the person, you compromise with the loss and you get going. You start taking up the responsibilities. So in this case, what happens is there is no healthy grieving taking place. The person is not able to vent out. The person is not able to talk about what he or she is feeling about the loss. Right? And because of this, sometimes in the long run, it can have a severe impact on the person's health, only because the person was told to shut down, the person was told not to talk about it anymore. Right? Even when it comes to culture, sometimes certain cultures don't allow men to express their emotions, whereas women are allowed to cry, whereas men, they are not allowed to cry. Rather, the moment there is a death in the family, first thing people will do is catch hold of the men of the house, the elder son, or uh, you know, and tell them that, okay, now this person is gone, you got to take up the responsibility. So what are we doing here is we are saying it's okay not to cry, it's okay not to feel for don't feel for the person. Okay, or even if you feel for the person, you don't have to talk about it because you already have responsibilities coming up. So we're not allowing them to sort of vent out. We're not allowing them to talk about it, and we don't when we don't allow them to talk about it, then it can have an impact on the health of the person, and people can go into clinical depression if even in clinical depression if people are not allowed to vent out, or people are not given a chance to talk about what they are feeling about the loss. Because in a family, if somebody is gone, then it's everybody who's experiencing the loss. Okay, we cannot say that, okay, because you're the elder son or you're the eldest in the family, it's okay to not feel and just go by, just hold on to the responsibilities. People have to be allowed to talk about their loss, and people have to be allowed to experience. And recovery, what we can talk about here is social support, reduce self blame, survivor guilt, and also stay connected with our loved ones. Now, whenever there's death in the family, these rituals would allow people to get together and share about the person, went out and talk about the person. But today it is not possible. So, what we need to do in these times when COVID has restricted our we are confined to our homes, it has restricted our us going to anywhere. What we can do is basically take support of people through the tech that is stay connected with your loved ones through video calls, phone calls. Okay, you know that your friend has lost her sibling, so maybe you can call her every day or talk to her, just chat with her, keep in touch with her. um, So families and communities must make special effort to reach out to grieving individuals, particularly those who live alone. So, at least when you have somebody in the family, you can still talk about it. But if you're all by yourself, then they need more support in order to deal with the loss. Now, besides this, what the four components that we need to pay attention to include exercise, social support, sleep, and diet, because these four they are very important when it comes to our mental well-being. Yeah. Now, moving on to the first one, that is exercise. Now, this reduces stress and anxiety and improves sleep. Some of the activities that can be done, considering the restrictions, include walk or jog. So you can go for a walk, you can go jogging, exercise with weights at home, okay, yoga, dancing, or practice Zumba. And today we have virtual classes, right? We have now adjusted to this virtual world. So maybe we can attend to virtual fitness classes or even attend Zumba classes through YouTube or your Google Meets. Yeah. Next is diet. So, yes, COVID 19 has made living more stressful, and we know that stress does affect our food preferences. So, physical and emotional stress increases the intake of food that is high in both sugar and fat. So, overeating as a stress behavior can affect our health severely, and therefore, it is important to maintain our diet. And healthy diet can help us live a healthy lifestyle. Next, we have sleep. Sleep is an important part of one's well being, and research suggests that sleep can reduce our mortality, maintain a healthy weight, reduce tension, decrease stress and depression, improve our heart health, and assist our thought processes, which benefits our overall well-being. So research has suggested that sleep has a significant role to play in our has a significant role to play when it comes to our well-being. And how can we help ourselves in getting a good night's sleep? First one is to create a routine around going to bed at bed each night. So instead of having these fluctuations in your timing, maintain a routine. So maybe by 9 you go to bed, so every day try and go to bed by 9 or 10, whatever time you wish to maintain, but maintain a routine. Because when you don't maintain a routine, then it's difficult for your body to get adjust. It's difficult for your body to adjust to the timings, the different timings that you are uh, the different times that are getting adjusted, trying to go to sleep. So try and create a routine for it. Second, spend time being more active in the day. So involve yourself, try and do some physical activities, maybe gardening, exercises, Zumba, as I said. So you spend time more actively in the daytime, because if you try and sleep the whole day, then your nights will be very bad, because you might not end up sleeping at night. So again, this will have an impact on your health. Also, reduce stress with exercise and meditation. So, yes, involve yourself in exercises and meditations, and that will also help you to reduce stress, and in turn will help you to have a good night sleep. Then we have social connectedness. Connectedness can improve our sense of self and well-being and overall health. So we all know how we are with our friends and how are we all by ourselves, right? Staying at home, we all know how it is. We are not able to go out anywhere. We're not able to meet our friends. Thankfully, we have social media, we have WhatsApp, we have phones to call and stuff, but still we still feel that loneliness staying at home. So social connectedness is very important, and lack of social connection can lead to loneliness and can even affect our interaction patterns. You might start be aware of here and be just be aware of what is happening right now, or just it's our ability to be fully present. Okay, so we are not going to talk about what's happening around us, what is happening, what happened yesterday, or what will happen tomorrow, but we are focusing on here and now. Now, this includes being aware of what we do and what we are without being overwhelmed or overly reactive to what is happening around us. Mindfulness is bringing the mind back again and again to the present moment. So even when you're listening to music, you might shift your thoughts. You suddenly catch yourself thinking about something else. Even when you're praying, you'll find yourself thinking about something else. So it is okay. It's completely fine to for your mind to wander around. But the trick, what is important here, is to get your mind self back to the present moment. So if you are having bath, okay, or if you're eating food, how many of us really pay attention to what we are eating? Yeah. So even as simple as we have these gems, right? We have this Cadbury gems. If you just try and taste them, the taste, if you really are mindful, you'll realize that each of this color has a different taste. Okay, and I'm sure we mostly talk about chocolate, which is inside the jam. But if you really taste each of this jam, you'll realize that based on the color, the taste is different. So this shows how mindful we are. Okay, we have our minds, but the question is, are we really mindful? Okay, we are walking. We talk to people. We are walking. We are, are we really? So I know that I have to go from. One room to another room, but am I mindful about what is around me when I'm walking from one room to the next room? That's the question. So how do we practice mindfulness? Is set some time aside, create your space. Okay, you can't be sitting in a noisy room and start practicing mindfulness. You have to sit in a place where there is no noise, where there is, where it's calm and peaceful. Let judgments pass. Now, what we do is we are our best critics, right? Whatever we think, we tend to sort of tell ourselves what we are before even somebody talks about us. So when you sit for meditation, when you sit and practice mindfulness, one thing that is important is do not judge yourself. Okay, there could be times you'll find yourself that you're not paying attention to the meditation. Your thoughts are just getting shifted. Your mind is just wandering. It is completely okay. Do not say, "Oh, I can't do it. Oh, it's waste of time. No, I'm not meant for this. I can't just do it anymore." Do not judge. Do not criticize yourself. Rather say, "Okay, I found myself, or I caught myself wandering. Now I shall get myself back to the present moment." So tell yourself, okay, it's okay to think about other things, but also it is nice to be in the present. Yeah. So instead of being critics, instead of being like those judges where you pass like strong judgments, just allow yourself to be yourself. Now, other things that we can do with the restrictions that we have around us is maybe watch movies, try out new movies if you love movies, listen to music. Okay, try out hobbies. Okay, if you're good in gardening, if you like to write stuff, maybe you can start writing. You can, if you love to cook, maybe you can try new recipes. Spend time with your family members. Yes, spend time with your pets. One of the best way of dealing with stress is just play with your pet, spend time with them, and also join clubs or groups through social media. Now that it is not possible for us to physically be present there, we can still join clubs or groups through social media. Yeah. Then we have daily practices. So in here, we are going to talk about these 4 important practices that includes gratitude, forgiveness, self-love, and affirmations. Okay, so what is gratitude? Now, there's so much that's going on in life, and are we really grateful to it? The fact that you get up in the morning, the fact that you are alive, okay, with so many people dying around you, you are still alive? How many of us really thank? How many of us really acknowledge? How many of us really appreciate the fact that we are alive? Very rarely we do that, right? So gratitude is something that we need to follow and we need to give attention to. Now, how we can do this is every day, maybe before going to sleep, if you could spend 5 minutes, all right, just 5 minutes, and write two things that you are thankful about. So initially you can start with two things, and you will realize with course of time, as you get addicted to this, you will just, throughout the day, you will only start thanking for all that you have. And this is a beautiful beautiful technique, because it just helps you to shift your perspective from, instead of focusing on what you don't have, it will help you to see what you already have. So please practice gratitude, and maybe for a start you can start acknowledging two things at a time. Okay, so maybe two things that you are thankful about in a day. So the fact that I woke up today early, and I could spend a little extra time with my parents before I left for work. That could be one, as simple as that. Or today I didn't miss my bus. Just another one. So it's as simple as this. You got to just be thankful about it. All right. Second, forgiveness. Now, forgiveness is not about having mercy. Very often when we look at forgiveness, we look at forgiveness as having mercy on someone. So it's like, okay, I'm doing a favor on you by forgiving you. Please try and understand, forgiving is allowing to let go things. Okay, so when you let go things, you are setting yourself free. It doesn't matter whether the person who has harmed you is okay with it, or you are okay. So it's your choice. So please remember, when you're trying to forgive, it is letting go things. And one of the most important thing that we need to do is forgive our own selves. Forgive ourselves. Sometimes we criticize ourselves so badly. We always judge ourselves. So we have to learn to let go. So if things have gone wrong, what have I learned from it, and how can I use this in helping myself grow? So that should be our outlook when it comes to forgiveness. So once again, what is forgiveness? Forgiveness is just allowing things to be the way they are, or just let go things. Do not hold on to things. That's forgiveness. Self-love. I think we are our best enemies. Okay, in fact, in reality, we need to be our best friends, but mostly we are always our best enemies. So we need to appreciate ourselves. We need to love ourselves. Okay, well, make sure that whenever you have your priorities, you are always first on the list. Okay, we are so busy loving everyone and anyone, but when it comes to us, we are not even in our list. So we have to have ourselves first in the priority list. And lastly, affirmations. So maybe have some affirmations for yourself. Okay, for example, I am in charge of how I feel, and today I'm choosing happiness. So despite of what is happening around me, I'm going to take a charge of myself. That is about how I'm feeling, and today I'm going to choose happiness. So what you're telling yourself is, no matter what happens, I will choose to be happy. All right. So these are some of the things that you can do on a daily basis. And lastly, some new perspectives that we can focus on. So maybe create new routines. Now, otherwise we had, okay, morning you wake up, you go for work, and that was your routine. But now that you have extra time, how will you try and use this routine? Maybe start teaching something, or write something, or what are you good at? Or just try and utilize your time in a new way. So create new routines, learn new skills, focus on social restrictions as an opportunity. So as I said, the perspective that we have, okay, instead of looking at this lockdown as very depressing and we are like confined to homes, let's look at this lockdown as an opportunity to spend time with our family members. And you can even tell yourself, I've slogged enough for last 5 years, so now let me take some rest. So it's the way you look at the situation. So it is important that we look at these restrictions as an opportunity to work on ourselves, rather than looking at it as a barrier. All right. And always try and use positive language. So instead of being critic, instead of focusing on the negative aspect, always let's try and focus more on the positive aspect and use positive language. So even when you're talking to people, and especially now, we don't know what people are going through. So let's use positive language and help ourselves to feel better, and help people as well to feel better. So with this, end my presentation. And before I move on, I would like to address to the questions that I received through the Google form. So there was this question about how to prevent suicidal thoughts. Now, because it's the suicidal thoughts, I would request the person to kindly seek professional help, because just working by yourself might, if you could refer to professional help. How can we keep calm while people out there are dying, suffering due to various reasons? Hunger, children becoming orphans, and many more. Definitely, for this question, the answer is already there in our slides. We said, first of all, we got to understand whether we can change the situation. First question is whether I can change the situation. If I can, then if we cannot, then we got to accept it. Ways one can cope with being unemployed for over a year and a half. Well, you got to explore yourself and see what you're good at and what are the different ways. You got to explore ways that can help you to sort of take care of your finances. Maybe look out for new ways and join some places where they do provide jobs and deal with it. Then there was a question on changes in education systems. So I wasn't sure what exactly this question, what this meant. So if somebody could just, the person who has posted this could briefly put it in the chat box, then maybe I could address that. Posted this could briefly put it in the chat box, then maybe I could address that. Yeah, we spoke about mindfulness already. How does one deal with frustration during this prolonged period of homestay during COVID? So yes, we have spoken about the perspectives and how we can start looking at things from a new perspective and the daily practices that we have put across. How to have a positive mindset with everything around you when everything around you is negative. Yes, first of all, be mindful. Now, when I say that, just shift from what is happening around you and shift to here and now, it doesn't mean that we can completely avoid what's happening around us. So allow yourself to accept what is happening around you. Okay, the moment you're aware of what is happening around you, ask yourself whether my reactions, whether this can help me or no. If they can help me, definitely. If I can help to wipe off the situation, then yes, please do so. But if not, then you got to accept that you cannot do much about it, and rather start counting blessings that you already have, and that will help you to sort of maintain a positive mindset. To help others cope with the fear inflicted on their minds, especially those not ready to forget and let go. So here, one of the things that you could do is just allow people to talk. That's more important than anything else. Today we don't have listeners. Today we just have tellers. Okay, everybody will tell you what to do, but sometimes we just want someone to listen to us. And while we talk, we ourselves can come up with solutions. So just allow the person to talk. Okay, and as the person talk, the person will definitely be able to help themselves. Another thing that you could do is ask the person to think about it as to what can happen at the most. Okay, and for example, if I'm infected with COVID, or if I'm diagnosed with COVID, if I'm tested for COVID, then what me at the most? All right, and what can I do about it? So when you start questioning these your thoughts, it will definitely help you sort things out. As many people are facing troubles regarding many issues and thus are feeling in the trap of depression, so in such situation, how to overcome depression and be more productive? Yes, as we have already discussed, if we start focusing on already what we already have, that will help us to see things differently. But if it is a clinical depression, again, I would request you to kindly take up professional help. Uh, how to train the mind to be calm? This is, I think we have already answered this question. Forgiveness and self-love, we have already done. And how to overcome financial crisis? Okay, so this question about financial crisis, you will have to check again. As I said, you will have to explore and check out the options available for you to generate finances, and then accordingly work on them. Yeah. So I'll just check for some more questions if I have.
Dr. Cindy,
Yes.
there are a few questions on the YouTube.
Okay.
Shall I read it out?
Yeah, because I don't have access to that. So if you
Yeah.
could.
Okay. So to deal with kids during the time of grief.
Okay. Normally, what happens with kids is we, as elders or older people, we don't about grief, and there are so many cases where people tend to lie to these young mothers gone somewhere else, and she'll come someday, or God has taken her. We give them these weird explanations. So in this case, what I would suggest is that the kid or the child has to be aware of the loss. It's okay for the child to cry. It's okay for the child to be aware of what is happening. The moment you do not allow the child to understand what is happening, what we are doing is we are damaging the child. So I would request people to allow people children to witness the death. Okay, so if the person is dead, then it is important that we inform them that the person is no more, and they will have no access to the person anymore. So that itself will allow them. And then how we can deal with them is maybe just talk to them about the best of times that we shared with the person who is no more, and allow them as well to talk about the person who is no more. So that way we can help them deal with the loss.
Okay. There is one more question.
Yes.
Two, in fact. The second one is, we are being rude and disturbed during COVID-19 pandemic. And during this pandemic, it's really hard to manage our relation with loved ones. How to deal with it? And secondly, being disturbed makes hard to meditate.
Okay, I'll answer the second question first, and then I'll come to the first question. So, if we are saying that being disturbed, it's hard to meditate. Yes, it is hard to meditate because we know how our thoughts are, right? They just keep on coming, and they come always at the wrong time. That's another thing with our thoughts. But what we need to do is, instead of being judgmental and instead of being critics, and tell yourself that the more you try to push your thoughts away from you, what you're going to do is you're only going to make them sort of attack you more. So it is important to accept that yes, these thoughts are there. I am thinking something about. Okay, just be aware of what you are thinking. It's completely fine. And as you think, just try to understand. And one of the slides we spoke about how to check out whether there are distortions. Okay, so check for distortions. If there are distortions, then get them verified with reality, and then reframe your thoughts. That's the answer to the second question. Mrs. Manjari, could you just repeat the first question for me again?
Yes, it says, we are being rude and disturbed during COVID-19 pandemic.
Okay.
And during this pandemic, it's really hard to manage our relation with loved ones. How to deal with it?
Okay, so for this, now that you're aware that you are rude to the person, right, and you're aware that we are not able to sort of have healthy relationships with people. So what I would suggest here is, what you could do is, once the event has taken place, you're angry, you're upset, and you're not happy about the fact that you are dealing with your relationships like this. Maybe what you can do is you can take a paper, all right, and just write the situation on a paper. And once you write the situation on a paper, just check out for the thoughts and feelings that are there in this. So what made you angry? Maybe the person was just kidding around, or just cracked a joke, and you just blasted, you just fired the person. So write down, because this person said this, I reacted like this. Now the person was just having fun, but for you it was not. Now what is the problem here is, you are disturbed with something, and that joke has triggered this issue that is disturbing you, and therefore you reacted in a certain manner. So what we can do is just break up our thoughts and feelings triggered these emotions, and then accordingly just be mindful about it. And then you can maybe in the end write down, saying that, okay, instead of reacting the way I reacted, was there any other way that I could use to react? And write it down. Just be aware of it. So next time when things come up, possibly this will help you to be mindful when you're talking to the person, and will help you to sort of go. And at that time, maybe once you realize that, okay, things have gone wrong, a simple apology should really help you out at that moment. But the moment you start keeping a track of your thoughts, your feelings, and understand why certain things are triggering, okay, why is it that certain things have been triggered, that will help you to keep a track of yourself. Yes.
Yes, there's one more question.
Yes.
The question is, how can we integrate mental health awareness in the school curriculum in Goa?
Okay, so this is something that the teachers can do. Normally as teachers we focus on completing a syllabus, and then how we go about it is make sure that we are only talking about that people should get good grades, people should really focus on their academics despite of what is happening around them. But instead of doing this, if we could just allow people to be themselves, okay, and instead of penalizing them or picking on them, rather we just a simple communication with our students about how are they feeling, what's happening in their lives. These simple things can really help them sort of understand, or make them feel that they're acknowledged. And at the same time, even the way we interact with our students can make a huge difference. So we all are going through the tough times, but still just be mindful of what you are doing, and accordingly interact with people. And if you're talking about getting the whole concept of mental health into this school curriculum, we can have mentorship programs like we have in our college itself, where and they can have communication, or they can communicate their problems to their mentors. Yes.
Yes,
Yeah.
that will, yeah.
I don't see any questions on the Google Meet. So yes. Any more questions? There, I don't know whether this is a question, but I would like to address to this from Mr. Rajaram Kadam. It says, time is the concern. It's just not possible to go to bed by 10 or 11 p.m. Otherwise, one cannot meet a next day's commitment. So maybe here we need to sort of discipline ourselves and maintain the routine, as I said, that like maintain a fixed routine. No matter what, try and make sure that you have a fixed timing wherein you go to bed. Also, avoid using mobiles, laptops at least 1 hour before your timings. Make sure you stop using all the gadgets, because they also can lead to they also can stop you from going to sleep. They sometimes you get so addicted to these jokes and some YouTube videos, and you are caught up with them. So make sure that after your dinner you just take a break of 1 hour or so, and have and make sure that you don't have access to all these gadgets, so that could help to sort of go to bed in time. Yes, Mrs. Manjari, I think I'm done. There are no more.
There is a question on the chat box. Uh, it says, what according to you is the best way to silence the shame revolving around mental health?
Okay, so what? Okay, creating awareness. A lot of people aren't aware. I'll just give a simple example here, a little away from here though. When we talk about this whole mental health issue, people label them. Okay, if you take a mentally retarded child, and this is what I have observed, right? Sometimes in buses, people pass nasty comments. People talk very. It's very nasty to even hear what they're saying. So in this case, when you create awareness, people just see and they comment. But what we need to do is create awareness about the mental health, because if you create awareness about mental health, people will be aware of what is happening. It is just not a problem. People are going through lots. The family is suffering. The people, the family members of this child are going through lots. The child himself is going through lots. So by creating awareness, yes, that's the best way to deal with problems that are related to mental health, or best way to silence the shame revolving around mental health. So, yep. Dinah, I hope I answered your question. Miss Dinah?
Yes, ma'am.
Okay.
Yes, I think that is all. I can't see any more questions.
Same here. So I think.
All right. I can't see any more questions. So I think, okay. All right. Thank you, Dr. Cindy. Um, Before we bid adieu, I take this opportunity to propose a vote of thanks. I, on behalf of Department of Psychology of DCT's Dhempe College of Arts and Science, Miramar, extend a sincere gratitude to the resource person of this national webinar, Dr. Cindy DSilva, for sharing with us valuable inputs that will certainly assist everyone in tackling the various emotional challenges that COVID-19 has placed before all of us. I extend a heartfelt gratitude to the principal of our college, Professor Vrinda Borkar, for her words of encouragement and support. I thank the system administrator of our college, Shri Gaurang Bane, without whose technical assistance the webinar would not have been possible. I express heartfelt gratitude to the HOD of Psychology, Dr. Mukta Karmadi, and my colleagues from the department for their cooperation. Last but not the least, I sincerely thank all the participants of our webinar for making the event a success. As it is said, all good things must come to an end. Before we bid adieu, a gentle reminder to everyone to fill in the feedback forms. The link has been shared in the chat box. Kindly fill in the form. Good night, happy weekend, and stay safe. Dr. Cindy, are you trying to say something? Because I think you haven't unmuted yourself.
Yes. Thank you, Manjri. So yes, I would thank our head of the department for giving me this opportunity. I would like to also express my sincere gratitude to